renal calculi, nephrolithiasis, urolithiasis, or with what most people know as kidney stones, a disease so common affecting 12% of the world population. But how can we protect ourselves from it or even cure it? To prevent or cure any disease, we must first learn what it is, its causes, symptoms, how we can prevent it, and lastly, its treatments.
Firstly, let's start with understanding what it's about. Simply, kidney stones are hard minerals that form in the kidneys. They could vary in size, going from as small as a grain of salt to as big as a golf ball. Yet, don't let the size fool you, since the pain it could give is immeasurable, since these stones are blocking the flow of the urine, which holds pressure to the already very sensitive kidney, resulting in the pain.
But what causes these minerals to form? You might be asking. The answer to that question changes from a case to another. One of the major risk factors is obesity, since it increases the amount of calcium and uric acid in the urine. Another major factor is type 2 diabetes, because it increases the glucose in the urine, which could bind with calcium to form a type of stones called calcium oxalate stones, which is the most common type of stone. High blood pressure can also increase the risk of kidney stones. Metabolic syndrome is a group of conditions that combine all said causes, which increases the risk of forming kidney stones.
Regarding the symptoms of kidney stones, they are very distinguishable. They cause severe pain, especially when they move around inside the kidney or pass through into the ureter, the tube that connects the kidney to the bladder. We may not have symptoms until a kidney stone moves down the ureter. When this happens, the stone can block the flow of urine out of the kidney, causing severe pain that starts and stops suddenly. The pain may be felt in the belly area or side of the back, and it may move to the groin area, testicles, or labia. There are some other symptoms you may have, such as urine color, blood in the urine, fever, nausea, and vomiting.
Now you're wondering how to prevent getting kidney stones. We'll have three ways. First of all is hydration. Several studies have shown that increasing fluid intake reduces the risk of stone formation. With low fluid intake, urine output is decreased and urine flow is slower, both of which increase the risk of stone formation. Current guidelines recommend drinking enough fluids to produce at least 2.5 liters of urine daily. The second way is citric acid. Consuming fruit juice prevents stone formation not only because it increases urine volume, but also because it is high in potassium and citric acid. The third way is calcium. There is a common misconception that decreasing calcium intake will reduce the risk of calcium stone formation. In fact, studies have shown that the low dietary calcium actually increases the risk of developing symptomatic kidney stones.
Well, most small kidney stones are treatable without surgery. One little stone might be eliminated by one of two ways. 1. Drinking water. Drinking up to 1.8 to 3.6 liters of liquid daily keeps urine diluted and prevents the kidney stone's development. 2. By medication. By prescribing a drug to assist the passage of a kidney stone, such as Flomax. However, these drugs shall only be used after reviewing a specialized doctor. While larger kidney stones require either 1. Surgery to remove larger stones, or 2. Removal with a scope. To do this, a small stone from the kidney or ureter is removed by introducing a thin, lighted-tube ureteroscope with the camera into the ureter. Special tools are then used to either snare it or break it into pieces. Last option is removal via sound waves to break the stones for them to flow with the urine.
And that's about everything you need to know about kidney stones. Keep in mind, kidney stones could be a serious issue, and a visit to the doctor is always a necessity. This video was brought to you by B5A students, supervised by Dr. Hanan Al Masrawi, Batarji Medical College.